Hello all, I'm Dr. Neema Bhat, Senior Consultant Hematologist, Pediatric Oncologist and Bone Marrow Transplant Physician. I'm also Director of the Bone Marrow Transplant Unit at Bhagwan Mahavir Jain Hospitals in Bangalore. Bleeding disorders in women. Again, a very less addressed topic, but a very important one. As I've mentioned in my earlier videos, women do not seem to pay attention as much to their health as they should be. Why is it important to know about bleeding disorders in women? So you might have had an aunt that would have told you, I've always had very heavy periods, I've had very severe cramping, I've been diagnosed with anemia, a grandmother or aunt who might have had to take their uterus out because they had severe bleeding. Somebody who might say, I received 1 or 2 units of transfusion after I had my baby. All these can be salient features in history to point out that there may be a history of bleeding disorders or bleeding diseases in the family. So why is it important for women to pay attention to their bleeding history and to know more about bleeding disorders? As we know, women have regular monthly menstruation period, and that is a period when bleeding happens naturally. But when this bleeding happens abnormally and is not paid attention to, excessive bleeding can cause you to have severe anemia. Why can excessive bleeding happen, or what is the reason excessive bleeding can happen? There are certain bleeding disorders that are very less known. So there is a disease called von Willebrand disorder that will only cause excessive menstrual bleeding or will only cause excessive bleeding post-operation or post-labor. And most people don't even know that they have it. But if you know, or if you're able to find out that you have this disorder, it is possible to make sure that excessive bleeding can be prevented and the patient is not going to severe anemia. So it is important for every woman to maintain or watch their menstruation cycle. Normal menstruation cycle should happen once every 3 to 4 weeks and should not last any longer than 5 to 7 days. Of the 7 days, the heaviest bleeding usually happens for about 3 to 4 days, and the first one and the last 2 to 3 days are usually lighter and should not require to change multiple times. If this is off, which means if you're having bleeding lasting longer than 7 days, especially with heavy bleeding lasting longer than 5 days, and you're having to change more than 5 to 6 times a day because of heavy soakage, if you're passing clots that are larger than the size of a grape, if you feel really drained out at the end of a period and you feel like you're not able to carry out your regular activities, you're having headaches very frequently, you're getting extremely exhausted, you feel dizzy, you feel tired, short of breath, unable to take the stairs, these are all red flags and need to be paid attention to. If you feel you're having severe bleeding and you've had severe anemia that requires treatment either with IV iron or oral iron tablets, that needs to be something that has to be mentioned to your physician and help you seek out the help or a consultation of a hematologist. A lot of bleeding disorders, as I say, go undiagnosed, and it's very important to diagnose them at the right point, especially in young women, so that if you're planning for a family and if you're planning for a child, it's very important for you to know this beforehand before you go into a cesarean section or labor, so that excessive bleeding and death related to excessive bleeding sometimes can also be prevented. So what do we do as hematologists? So as a hematologist, we again get a detailed history. If there is any history of bleeding, excessive bleeding in the family members, if there is a history of hysterectomy or removal of uterus in any of the family members, if anybody has required transfusions multiple times, so that is a red flag, which makes us sure that we evaluate the patient in more detail and more depth to see if we can diagnose them with a bleeding disorder and treat them appropriately. Hysterectomy, or the removal of uterus, is a surgery that used to be performed routinely in the past for heavy bleeding, but it does not have to be that way. If it is a bleeding disorder that can be picked up or diagnosed at the right time and can be treated, you don't have to undergo a major surgery called hysterectomy or removal of uterus just for bleeding if you can prevent the bleeding. If you have any further questions regarding bleeding disorders particular to women, how to diagnose it, what is it that you need to know, more about bleeding disorders, what is the treatment, and what you should know as a woman about your menstrual history, please feel free to reach out to me, Dr. Neema Bhat. I'm a senior consultant hematologist. Thank you.